pandemic is an outbreak over infrastructure in place to make enough vaccine to get us to where we would want to be were we to be hit with a pandemic flu.
Some of the numbers from the CDC about the H1N1 flu, the number of hospitalized cases here in the U.S., just over 5,500
Right.
deaths reported at 353.
Right.
And the total number of states and territories reporting cases, would that be 47?
Yeah, plus some territory. So the answer is it's widespread throughout the country. There's no doubt.
What's the difference between a pandemic and an epidemic?
That's a great question. We actually just wrote
Sure.
we wrote an article. An epidemic is an outbreak over and above what the standard level of disease is. A pandemic is an epidemic of a disease widespread throughout multiple regions. So if you had an outbreak of something here in Washington, D.C., or perhaps in a few states, it could be an epidemic. If it's all over the world, it's a pandemic.
So pandemic, if you could call it,
Is a big
that's a more
epidemic.
alarming.
Exactly.
That's a more alarming term when you see
no,
that.
no doubt, no doubt.
First call for Dr. Fauci, Palm Coast, Florida, Republican line. Chuck, you're on the air.
Good morning. I had a question. Well, I actually have two short questions. First one is, how much is it going to cost us destitute Americans after the economy is doing us in for these shots? Part two of the question is, what percentage of that goes to the Obama administration?
Well, okay, the first question is that the federal government is purchasing these doses, unlike seasonal flu, where it is made by companies and it's distributed to distributors and you have to buy the public, either through health plans or what have you, have to buy the vaccine. This is one that the federal government has bought. So strictly speaking, it's not going to cost the general public anything to buy the vaccine. And there's no profit for the federal government. The Obama administration, or in any situation, is there federal government profit for it. In fact, the federal government has put out a few $1 billion to get this program going, as well as giving to the states about $350 million for preparedness, both at the hospital level and at the local level. So there really is federal government putting money into it to make it available for the American public, as opposed to getting something out of it.
So how, the average person, they
Right.
want to get this shot.
Right.
It's free for them?
Yes.
So they go to their doctor.
Right. Right.
And but they're still paying for the doctor visit?
Yes, yes.
Okay.
I mean, obviously, the things
Right.
that would have to be paid for anyway,
Right.
but the actual dose of the vaccine is purchased by the federal government.
How will it be decided who gets the vaccine? You talked about kids going back
Right.
to school. Who else?
Well, there's 5 target groups that has been decided upon and discussed with a committee that we use very frequently, that the CDC relies on, called the Advisory Committee on Immunization Practices, the ACIP. And the recommendation is that we target 5 groups. And the 5 groups are pregnant women is at the top of the list, because we're seeing that pregnant women in general with flu are prone to severe disease, and we're seeing that with this H1N1. The others are those who are caregivers of individuals, babies who are less than 6 months old, healthcare workers and people on the front lines, young individuals who are healthy from 6 months old to 24 years old, and then adults, non-elderly, adults meaning 18 to 64, who have what we call underlying conditions that compromise their immune response. Transplant patients, people on drugs, immunosuppressive drugs, people with diseases that compromise their pulmonary, cardiovascular, or renal systems.
And why not elderly?
Well, right now, it's interesting. It's not that they're not going to be able to get this vaccine, and I want to make a point in a second about the difference between this and the seasonal vaccine, but if you look at the history of this pandemic over the last several months, it is appearing to spare the elderly, in the sense of suggesting very strongly to us that people who are of an older age group have been exposed to a similar type virus or have been vaccinated with a vaccine that gives cross protection sometime earlier in their life, whereas younger individuals weren't even born then. So there seems to be much less of an impact in disease and severity among elderly individuals. So that's why they're not in the 5 target groups.
Let's get back to those calls. Bakersfield, California. Billy, you're on the independent line. Hi there.
Hi. I have just 2 quick questions. The first one was, is it going to be a nasal method or a non-mercury-based method for my children to get this back?
Let me stop you there first and get an answer.
Okay, so there are 2 types of